Welcome, Shari. So you come here from the After Cancer Treatment Transition Clinic, or ACT. Would you mind please explaining for us what that is?
So the After Cancer Treatment Transition Clinic is a joint clinic program with Princess Margaret Hospital and Women's College Hospital. It's for survivors of several different site groups of cancer that have been in part treated at Princess Margaret Hospital, that are now disease-free and continue to need some surveillance follow-up in their care. So they're transitioned from Princess Margaret Hospital to Women's College Hospital to continue their surveillance follow-up. At some point, usually on average 5 years post-cancer treatment, they are then transitioned to their primary care team, which could be a family doctor or a nurse practitioner in the community.
Could you tell us a little bit about how you became interested in it and your professional background in this area?
So I've been a nurse for over 20 years, and most of that time I have predominantly worked within cancer care or oncology care, and I was looking for a new challenge and also a role that would enable me to work more directly with patients and families.
So if there was one take-home message from this ACTT study to deliver to patients, what do you think it would be?
Know that at some point you will be transitioned and that your family doctor will take over the surveillance post-cancer treatment of your care, of your surveillance for the previous cancer or cancers that you've had, assessing for other chronic diseases and other cancers. And they're a key healthcare provider that you need to partner with. So if you've lost that connection with your primary care physician during treatment, you need to reestablish that. Keep them in the loop what's happening, make sure that they understand high level of what your cancer treatment entailed and what you understand the follow-up should be ongoing as you age.
I understand it could be a bit scary or intimidating for people once they've been working with their oncologist and a specialty team through their cancer treatment to then go back to generalist care for follow-up. What can people do to make sure that the appropriate follow-up is being done?
Healthcare is about partnering with your healthcare providers. It's not the physician telling you what to do. It's a partnership. You need to build teams with your healthcare provider and then work together. You express your needs, you advocate for your needs, and as well, the family doctor or practitioner then works with you.
So let's say, hypothetical situation, cancer survivor, finished their treatment through the hospital, they're going back to their first follow-up appointment, transitioning back to primary care. Are there questions they could ask? Are there specific things they can do to help that primary care physician in that transition, or to make sure that transition goes smoothly?
So I think the first question is, do you have a summary or do you understand all of the treatment, high level in general, of what happened during my cancer treatment? Did I have surgery? Did I have radiation? Did I have chemotherapy? Do you have all of that? Do you know the stage of my disease? Okay. And if that basic isn't there, then it's a conversation, because the patient or the family member will know to fill in those gaps, and then have the conversation. I understand I need X imaging done every year for 5 years, or this blood work, and then have that conversation. It's important that we also monitor my blood pressure, or look, these are the signs and symptoms that may be suggestive of recurrent disease, that if I have them, I will be coming to you, and then we would develop a plan on how to make sure and rule out that the cancer isn't back.
Okay. Thank you so much for coming in.
Thank you very much.